We are going to stay in Africa now and talk about the fight to contain the outbreak of Mpox on the continent, one that has sparked a global health emergency. The WHO says the first delivery of vaccines is expected to arrive in the Democratic Republic of Congo in the next few days. It's dealing with a new strain of the virus that has spread across parts of the continent, and we also have cases being reported outside of Africa.
The new Mpox strain is spreading and changing fast. The virus is morphing in areas where experts lack the funding and equipment to properly track it, meaning there are several unknowns about its severity and how it's transmitting. The new strain, clade 1b, was first identified in April in samples collected from a gold mining town in the Democratic Republic of Congo's South Kivu province. It is potentially more lethal than the Mpox outbreak in 2022, which was driven primarily by male-to-male sexual contact. The clade 1b strain can be transmitted through any kind of physical contact or contaminated material. The crowded conditions of Congo's refugee camps have caused the virus to spread rapidly. On August 13th, Mpox was declared a public health emergency in Africa. Just a day later, the WHO released this statement.
Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern.
The WHO says that Congo now has over 18,000 cases, and over 600 have died as a result of Mpox this year. At least 12 countries across Africa have registered a spike in cases of the virus. Sweden was the first country outside of Africa to record a case of the clade 1b variant from a person who had travelled to an affected area of Africa. Children have been disproportionately affected by this outbreak, accounting for approximately 70% of cases in Congo.
You see children in the IDP camps, they are always playing together, so they have time together. They don't really care about distance, social distance, they don't care about that. So they play together, they are always together. And you can also see, like in the household, they even pass the night on the same bed.
Children, as well as pregnant women and those with weakened immune systems, are more likely to suffer severe symptoms and die. Children who contract the disease are more than twice as likely to die than adults. The Congolese government hopes to start vaccinations soon, with children first in line. But the arrival of shots has been slow. Efforts to contain this disease are becoming increasingly more difficult.
Well, I'm joined now by the epidemiologist and health economist Eric Feigl-Ding. Eric is co-founder of the World Health Network, which was created during the COVID pandemic. He joins me now from Washington, D.C. Eric, it's good to see you again. So the WHO says that, 230,000 Mpox vaccines are ready to be shipped to the DRC to get things going in a couple of days. I mean, is that the solution? We've got a vaccine, do the vaccinations, and we will solve this problem?
Well, I think it's definitely a key part of the solution. The only problem is that WHO, while they're shipping and allowing countries to buy the vaccine and donate it to the DRC, has not actually formally approved the vaccine yet. And so the vaccine's approved by Europe and the US FDA, but the WHO still needs 2 more weeks to actually approve it, they're thinking. But that said, many countries, including Spain, Japan, have already pledged hundreds of thousands and millions of doses. But we still have to get the shots into arms, so to speak. And again, the deployment of this will still take a lot of time. So I think overall we need probably about 10 million doses for Africa, and we haven't even scratched the surface of that right now.
What about people who were vaccinated 2 years ago when there was another outbreak of Mpox? Do they have protection and immunity from this latest strain?
Well, first of all, the vaccine is the same vaccine.
Okay.
The Jynneos vaccine made by the Bavarian Nordic is the main vaccine, and there's also another one made in Japan, which is also can be used in children. The vaccines actually have formulations and not changed. We're just pulling these vaccines off the shelf for the previous, because originally they were designed for smallpox, but they also work against monkeypox. And just today, U.S. approved another one of the older smallpox vaccines, the ACAM vaccine, for this, if necessary. Even though ACAM is a little more severe in its symptoms, there is a stockpile of these vaccines. The issue is, will the WHO approve them soon enough? And the deployment is the greater issue, because this strain is definitely much more transmissible than the one we had 2 years ago.
Yeah, I wanted to ask you about that. I mean, the danger level here of this new strain, where would you place it in terms of the Mpox that we already know?
Yeah, the previous Mpox was definitely much more sexually transmitted in predominance and close contact, not necessarily just STD fluids per se. But right now, the 70% of the cases are in children, and that clearly shows that it's clearly much more transmissible. It's not just sexually transmission requirement. And I think they don't actually know the details of the transmission. They don't know exactly what the mechanism is, but we think it's close contact. And possibly there's an open debate about airborne aerosol droplet spread as well. So right now they're investigating this. It is definitely much more transmissible. The severity, according to WHO, currently is about 3.5% mortality. It may not be that high because we're missing a lot of undiagnosed cases in Africa, but it's still definitely not a mild illness. And there is serious mortality, especially among vulnerable children. There are majority of the cases.
The WHO has issued an emergency appeal to fund an Mpox global strategic preparedness and response plan to basically stop transmission of this virus. What should a global plan include?
Well, I think part of their global plan includes funding for the 10 million doses that the WHO has called for. And we're not even scratching the surface of that 10 million. They're asking other countries to donate these funds, and also for these companies to cut the prices, because currently the prices are $70 to $100 for these vaccines. And that's just not sustainable for, Africa. And I think right now, ramping up production, trying to get permission from these companies to have the tech transfer to produce these vaccines more efficiently in lower cost settings, and of course the ramp up and getting more countries to contribute. I think altogether they're part of their global strategy, but right now they haven't even scratched the surface.
Epidemiologist Eric Feigl-Ding from Washington, D.C. Eric, it's always good to see you. We appreciate your valuable input in this story. Thank you.
Thank you. Take care.